I'm Joe O'Connor, editor-in-chief of the Explore Big Sky newspaper, and we're here with part 2 of our video series on coronavirus. We're at the Big Sky Medical Center, and we're about to speak with Jason Smith, Chief Advancement Officer with Bozeman Health. Jason, thank you for taking the time to come and to chat with us. I wanted to ask you, from a Bozeman Health and Big Sky Medical Center perspective, what are you guys seeing?
Yeah, well, first I want to reinforce that the team here at Big Sky Medical Center, the entire Bozeman Health family, are taking the COVID-19 emergency extremely seriously. We have been through the spread of disease in the past, but we feel like this is one at a time where we need to really pay close attention and make sure that we inform our communities to the very best of our ability. I would offer, Joe, that the first potential presentation of a COVID-19 positive patient happened on February 10th. Now, ultimately that patient was not confirmed as positive, in fact was identified as negative for coronavirus. But that gave our teams an incredible opportunity to trial run their ability to meet the needs of patients who eventually will present positive for COVID-19. It gave us the opportunity to work with emergency management through transport and how we might bring a patient who we believe is positive into our facilities, either Big Sky Medical Center or Deaconess Hospital. It gave our teams the opportunity to trial and test their personal protective equipment. It gave our facilities the opportunity to test negative airflow. And it gave our teams a real sense of what it might be like or will be like when we do see an uptick in patients, and that was important for us.
Wow, what an interesting situation, and you know, in some ways a bit of a blessing in disguise to be able to run through some of those potential scenarios.
Yeah.
You know, in an emergency situation, people come forward, they want to help. How can people help? What would you suggest?
I would key in on a few things. First, there are steps that individuals can take to help us flatten the curve and limit the spread of COVID-19. Wash your hands frequently and take advantage of that 20-second window in your day to sing happy birthday twice. It sounds silly to say it, but the reality is soap has a huge impact on this virus in particular. Second, social distancing does have a positive impact on the spread of a disease like this. So far it seems like leaders and community members across Big Sky are leading the way. We're seeing people really take the right kinds of sensible precautions. And third, I would encourage people to help us spread the word, specifically to how limited our state's access to testing supplies for this disease are. We understand that people are worried about their health and that they want to be tested, but when people come forward requesting to be tested, it requires us to utilize both the actual test kits available on a statewide level and the personal protective equipment that is also limited. And those that should be tested will have been in contact with someone who's been confirmed as having COVID-19 and have a series of symptoms and likely been in one of the zones where COVID-19 has been highly prevalent. For those that have not sort of checked both of those boxes, the likelihood of them being eligible for or needing to be tested is pretty limited.
Understood. And you know, from the testing kit perspective, you know, I wonder if you could speak a little bit to these kits in terms of, you know, in terms of those shortened supplies, in terms of you know, the process that one must go through should one meet those two criteria.
Many people are under the impression that local hospitals have access to the full test kits on site, which is actually not accurate. There is a single supply of test kits available on a statewide basis. What happens at Big Sky Medical Center or Deaconess Hospital is that swabs are taken, samples are taken, and those are then sent to the state lab for testing. Now, originally, I think many folks across our communities heard that there were only 200 test kits available on a statewide level. We saw that grow to 600, it grew to 1,000. There's some increasing testing happening, but we're still in really limited supply. So what happens locally is we do swabs, send those swabs onto the state, and then wait for the state to inform the county health department about the outcome of those results.
Well, that's really interesting, I think, for people to hear in terms of what the process looks like, but also, that they must meet these two criteria to be tested, and I can see why that is being enforced with limited supplies. Back to the Big Sky community, are you speaking to community leaders? And if so, what are you guys discussing?
Well, whether it's Dr. Catherine Burtney, president of Big Sky Medical Center, and her ongoing work with the Big Sky Medical Center Community Council, or others across the Big Sky Medical Center and Bozeman Health team engaging with community leaders at the Resort Tax Board and the resort and the clubs, we're in very frequent and active conversation. First, we want to celebrate the decisions that they've made. We know they were difficult. To begin standing down the number of people who they're hosting, we know that that's going to have a positive impact. Second, they've encouraged us in our preparedness at Big Sky Medical Center to be bold, to anticipate very challenging days ahead and to get ready for that. And they've committed to coming alongside us to help make that happen, believing, I believe ultimately, that even if we are fortunate, even if the impacts of coronavirus on Big Sky this year are less than we anticipate, the investments we make, the steps that we take will help prepare us for what might come down the road in the future. This is unlikely to be the last health emergency that this community faces, and we really appreciate the extent to which they're planning effectively, they're making difficult but right decisions, and they're encouraging us to be pretty ambitious and creative in the way we're planning for the future.
Got it. Can you speak to any of the specifics involved in those conversations and what that could look like for potential, overflow, should there be a larger group of people that we're finding are, potentially testing positive?
So there's a couple of scenarios. First, there is good capacity at Big Sky Medical Center today between our 4 inpatient rooms, our 6 emergency department rooms, additional rooms available in the surgery suite area. It's also worth noting that as part of the broader Bozeman Health, those who are most critically ill would likely move to Deaconess Hospital's intensive care unit anyway.
Sure.
So that creates a bit of additional capacity. And then ultimately we're looking at planning for expanding capacity in some really creative ways in open spaces should we ultimately need to get there. What the community's told us is that we need to plan for a pretty significant impact. We're hopeful it doesn't happen, but if it does, we're confident we'll be ready.
Absolutely. Jason, I really appreciate your help and speaking with us today. The messaging to us and to the community is critical in times like this, and so I really appreciate your time.
We appreciate your time as well. You guys have been great partners and it means the world to us.
Sounds great. Thanks.